Do you frequently feel like your heart is racing, even when you're just sitting down? Or maybe you feel tired all the time, like your body is running on empty. These could just be from stress, but sometimes they're clues that your bone marrow isn't making blood cells the way it should. That's where myelodysplastic syndromes, MDS, comes in. Think of your bone marrow as a factory that makes red blood cells, white blood cells, and platelets. In MDS, the factory is damaged. It's still running, but the workers are making faulty products. This leads to not enough healthy blood cells. Most people with MDS are older adults, and it often develops slowly. The tricky part, early on, you might not feel much at all. But over time, as the bad cells crowd out the good, symptoms creep in. It's like a slow internet connection. Things keep working, but nothing runs smoothly. Sometimes, we just don't know. It happens by chance as people age. But other times, we can point to a reason. For example, have you ever worked in construction or painting and been around chemicals like benzene for years? That can damage bone marrow over time. Or what if you've had chemotherapy or radiation for cancer? Those treatments save lives, but they can also injure the blood-making system, sometimes years later. Smoking is another big one. It's like slowly poisoning your blood cells. And in rare cases, genetic changes passed down in families can increase the risk. But mostly, MDS is a wear and tear disease, like a car that's been driven too long without proper maintenance. Let's play a quick game. Raise your hand if you felt unusually weak lately, like carrying groceries feels like climbing a mountain. What about looking in the mirror and noticing your skin looks pale or yellowish? How about small red spots on your arms that look like tiny bruises but don't hurt? These are all clues. MDS causes low red blood cells, anemia, so you feel tired and weak. Low white blood cells mean you get infections more easily. Maybe you've had more colds than usual. Low platelets mean you bruise easily or bleed longer from small cuts. One person said, "I cut myself while chopping onions and it wouldn't stop bleeding for 10 minutes. That's not normal. And some people don't feel anything. Their doctor finds MDS during a routine blood test. So ask yourself, is your body sending you warning signals you've been ignoring? First, they check your blood, a CBC test, which counts your blood cells. It's like doing inventory at the factory. If the numbers are low, or the cells look weird, they dig deeper. Then comes the bone marrow biopsy. No, it's not as scary as it sounds. They numb your lower back and take a tiny sample. It might pinch, but it helps see the real problem. Doctors look under the microscope to check if the cells are dysplastic, meaning crooked, broken, or strange looking. Once diagnosed, treatment depends on your age, health, and how severe it is. Some people just need regular blood transfusions, getting healthy blood from donors. Others might take medicines that help the marrow work better. In stronger patients, a stem cell transplant, getting new marrow from a donor might cure it. But it's tough and not for everyone. Think of it like rebooting a computer, risky, but sometimes it's the only fix. Can you prevent MDS? Not always. Aging is part of it, and we can't stop that. But you can protect your blood factory. Imagine your bone marrow is a high-tech lab. Would you let someone smoke inside it? No. So quit smoking. That's a big step. Avoid harmful chemicals at work. Use gloves, masks, and follow safety rules. If you're getting cancer treatment, talk to your doctor about long-term risks. Also, eat well and stay active. Healthy habits support your blood system. You can't control everything, but small choices add up. One patient said, "I didn't think my daily smoker's cough mattered, but quitting made my blood counts more stable." Your choices matter more than you think. Science is moving fast. Recently, doctors are using genetic tests to read the DNA in bone marrow cells. It's like finding typos in a manual and fixing them. New drugs target those typos. For example, some medicines help cells mature properly instead of staying broken. Others boost the immune system to clean up bad cells. And researchers are testing mini transplants, less intense, safer for older patients. There's even work on growing new blood stem cells in the lab. One trial used gene editing to repair faulty cells. Sounds like sci-fi, but it's happening. These advances won't help everyone today, but they bring hope. Remember, MDS used to be a death sentence. Now, many people live for years with decent quality of life. The future, even better.